Well, hello, Lanika. How are you, lovely?
Good. How are you?
I'm doing very well and very excited and happy and just appreciative that you are willing to sit with us and talk to us about your experience with COVID-19.
Of course, of course. I definitely appreciate you in the community and how you spread the word far and wide. So
Yes.
I'm gonna enjoy my time with you.
Absolutely, absolutely.
Mhm.
So, just to preface this conversation, obviously, Lanika, this is your experience. This is what you've been through. This is not, everybody else's. We're just talking
Mhm.
through with someone that has had contracted the disease, that is living through it, and just want to get some insight on as to what that's like for an individual. And
Sure.
so, yeah, right. So, as a
Mhm.
disclaimer, as a preface to this talk. But why don't we start here? I want to start with what even gave you an indication that you had COVID-19?
Um, well, I mean, I have for a number of years suffered from migraines, and so I just remember getting. Well, actually, I just remember one particular day, and I know it was a Wednesday just because it just was so strange. I remember sitting up and waking up and just feeling like so different and so bad, right? And, I just couldn't really put my finger on it. You know, I had now pretty much returned from China, so I was doing a little bit more, moving a little bit more. So I just kind of brushed it off to like fatigue and maybe not resting enough.
Yeah. And
And
when
then
was
it,
this, Monica? When was this?
this was probably in April.
April. Okay. Yep.
Mhm. And then, just started to get the really bad headaches. And so I'm like, well, this is a really bad one. And I'm having it for like several days. So this must be another migraine because I get them in different forms. And it just wasn't going away. And I was, I had no choice but to go to urgent care because I was just feeling so badly.
Hmm. When you got to urgent care, how did they confirm it? Or did they even think that's what it was initially? Or how did they go about triaging you to figure out what was going on? You're smiling.
Well, well, it
Process.
was the furthest thing from my mind. So, we didn't have a lot of the nurse, of course, the medical staff were taking their precautions, of course. So, they were dressed differently and, of course, prepared to screen for COVID. But I thought, I was just coming in and they were gonna give me some medication to stop a migraine. And she said, after listening to me and just really seeing how badly I was feeling, she said, I think we should test you for COVID. And that wasn't a big deal for me. The work I do, preventative efforts are always the efforts that we're for. So I just, you know, considered it an elimination of a condition. I really didn't even think that was possible.
Right.
But I consented, and the test was done.
Wow. Wow, that's
Mhm.
really interesting. Like they were probably just having very initial experiences too with COVID, very early for them, but good for them for, checking all the boxes to make sure that they figured out what was going on so that you could be treated immediately.
Yeah, I mean, it was so early, and on top of that, I had been working from home for about 2 weeks now, and because I deal with HIPAA sensitive information, I was behind closed doors, and I wore my mask. And I've always been obsessed with washing my hands, so
Right.
it really seemed like something that I could avoid. And
Wow. Wow.
fortunately, that wasn't the case.
Yeah, you did it in this case. Yeah, that's the troubling part. I mean, we all have to do the minimum, right? We know what the rules are around COVID-19 and how to keep ourselves safe, but really that's the minimum of what we should be doing to really keep ourselves from contracting this disease. At least do it as much as we can anyway, because it's not 100%. But tell me, so after this point, what's happening now? You're in the hospital. You tested positive for COVID-19. At this point, are they like go home and quarantine yourself, or
Yeah, yeah.
what's the process? Okay.
Yeah, so of course I was instructed to go home and kind of quarantine myself. However, I didn't get the diagnosis until the next morning, and it was really,
Wow.
miraculous. I think it was like 8 o'clock in the morning, and I was expecting a call. I was expecting a call saying that I was negative. I got the call first thing in the morning, and just from the tone of her voice, I was just saying in the back
Wow.
of my head, like, I know she's not going to say positive right now. And she did. She said, well, Anika, you tested positive for COVID. It was like I was blindsided.
Mhm, mhm.
Hmm.
Wow.
Yeah.
So then you were instructed to quarantine for how long?
I was, but I also had to consider I was, when I returned back from China, I moved in with a family member who was above the age of 60. So
Mm.
um, I had to advocate for some resources to quarantine and consider his safety at the same time. So as an upstate employee, I was eligible for care through them. And so upstate and the Sheridan Syracuse University partnered. And so the employees that um, tested positive for COVID and needed to quarantine were welcome to Sheridan.
Wow.
However, we were not allowed to leave our rooms, not even really to go get food. We were given a certain budget to order room service, and we were instructed to not open our door until someone called us and told us it was safe. So we were pretty much on complete isolation.
Wow. Yeah.
Yeah, yeah. For me, that was supposed to be like a 7 to 14 day process. However, the following day, I ran into some complications and needed to be rushed to the hospital.
Lanika, this is I'm living this story through your words. And I'm just blown away because, like I've told you, I don't know anyone that has had the disease. And so I don't know these firsthand stories from people I know, people that look like me, people in this community. And
Mm-hmm.
so to hear your story and to hear that you went through this is quite remarkable. And I'm just really appreciative that you're sharing this because I'm learning so much about this disease through your experience. So how do you so you had all this complication, and I'm sorry to hear that it even went further than that. How long were you total quarantine for?
Oh gosh, I think I probably quarantined for 21 days when I was only supposed to quarantine for 14 because I was
Mm.
so sick a good portion of the time. And actually, um, I have to say kudos to Upstate, kudos to our city for our response to something that we inevitably could not actually avoid. Whenever you have people, you have this risk of the spread. However, I immediately was equipped with a team of folks. They even used technology. So there was a iPad that was connected to all of the things that were monitoring me, taking my temperature, my oxygen level, my weight, everything really. And I had no idea that my oxygen level was dropping to dangerous levels. I just was tired and wanted to sleep. And
Mm.
then I got the call while I was at Sheridan to call 911. And I almost didn't. I really, because I'm like, you know what? I'm too tired. I can't even get up and go to the restroom. I don't want to go back to the hospital. I'm just going to sleep it off. But I didn't realize how urgent it was. As a matter of fact, they were outside the door with oxygen. So thankfully, I had that support because it could have been a different outcome for me.
Absolutely, absolutely. And what do you
And
go ahead?
I'm sorry.
Oh, go ahead.
I want to go back to your initial point. I'm sharing my experience, right? I'm sharing my experience because I agree with your sentiment. People who look like me live where I live. I'm a service provider that lives in the community I serve. Like I don't leave my community, so I serve and live in the same community. So I always try to look at these opportunities as an outreach or even an inreach. But what I want to stress is for me and for everyone, COVID is a very individualized process.
Mm.
No one has the same exact experience. They may have the same symptoms. They may develop at around the same amount of time, but this was a very individualized fight for my life. So against this virus. So I want to, stress that there is no set symptom, there is no set of rules. You just really have to pay attention to what your body needs.
Right. And probably what's normal for you individually.
Hmm.
And
Right,
know what
right.
that is and know when you're feeling off or something's not quite right or something may be going on with
Hmm.
you. Do you
Like
find
that Wednesday when I sat up, like, okay, wait a minute.
what's happening right now? I don't know what it is, but it's something is wrong. Something is wrong.
Something is wrong. Yeah, yeah.
Yeah, so you shared with us you had the migraines and that was one thing. Do you mind sharing any other symptoms that you had at the time when you were experiencing COVID, so within that 21-day period? And then I'd like to also ask you if you don't mind sharing how you're feeling today.
Hmm. So, I just really want to talk to those that don't believe that this virus exists, and, are kind of kicking against, the greater good around this of wearing masks, of social distancing and staying at home. It's very real. I had never in my life felt like this. I'd never like just kind of wanted to like curl up in a ball and fight for every breath, So it was a very real experience. A lot of my symptoms developed through my GI or my digestive tract. So starting from my mouth to the very end, including losing, and damaging my taste buds. For quite a while, I really struggled with eating, which is a huge thing when you're sick and you're not well. For the most part, I could only do like ice water and fruit for a very, very, very long time. And so I had everything that you can imagine going around in my digestive tract, every challenge. It also triggered some old issues that I had actually gotten under control around my kidneys. And of course, my kidneys not functioning properly also cause high blood pressure. So those are some of the lingering symptoms or effects that I'm still facing now. Uh, and of course, one of the most challenging one was hair loss, So you may notice that, got a little less hair. Um, I did go through um, that as well.
Well, yeah, like you mentioned, and we'll keep reiterating that this disease affects people differently. It may present differently. You may
Hmm.
have no symptoms at all, or you may have
Right.
similar symptoms to what you had, some or not any. So really just as important to understand your body and understand what you may be feeling and act on those feelings, considering we are going through a pandemic and COVID-19 is a very real
Very
disease.
real.
Yeah.
Yes,
So
very real.
with this final thought, I want to ask you, and you spoke a little bit to people that may not believe this is real because they haven't seen it, they haven't felt it, experienced it, they don't know anybody that has. I want you to talk specifically like you have to them and me, others too, about um, what you would tell them. They're
Sure.
listening. They're listening. Hopefully, they're listening. You have the microphone, and what you would tell them about this disease, about how serious it is, and what they should potentially do to keep themselves safe. What they can do.
Sure. Of course, I am still wishing everyone safe travels out there because, it's very much an issue. And it's an issue because there's a lot that we do not know, right? So, of course, education has always been one of the tools that we use to just be better and do better. So, I know we might be getting tired of all of this COVID information being thrown at us, but make sure you at least get enough to where you're educated and you're updated and you have reliable sources of information, um, as well as you know sharing that information with people that you love. Wear your mask, social distance. Try to avoid as many opportunities to be exposed to others, and exposing yourself to others as possible. And, let's work together to get this under control.
That's right. There's a huge initiative going on right now, and it has been running for the past several weeks, where down at the Syracuse Community Health Center, you can go and get tested for COVID-19 for free. You just go down there, you have to bring an ID, your insurance card if you have one. And it's the COVID Don't Bring It Home event where you go, you get tested, but there's also jazz musicians that play from 6 to 8. And again, I believe this is the last week for this particular event, but you can go at any time to be tested. On September 17th, which is Thursday, you can go down and be tested, listen to music, and also get a goodie bag of masks, sanitizer, hand sanitizer, and other things, pertinent information that you may need to help keep you safe during this time. Lanita, I cannot thank you enough for being vulnerable in this space. But your words, your story will travel. People will hear it, they will learn from it and benefit from it, and hopefully it will save several lives. Okay, so thank you again for agreeing to talk to me. I'm going to pass this along as far as I can pass it because I want for us to be safe. I want everybody to be able to live and thrive through this pandemic. We'll get through it, as you said, together. So thank
I
you.
like to support you in doing that. So thank you for this opportunity to share my story.
Absolutely. Thank you so much. Have a good
Okay.
evening.
You too. Bye.
Bye.